New at 6, the University of Tulsa professor is working on curing nightmares.
This story's perfect for this time of year. For 22 years, she's been working on curing nightmares for people with life stressors like PTSD. Fox 23's Paris Rain is live to tell us how the professor is trying to help people have sweeter dreams.
Yes, Rick and Sarah. I spoke with Joanne L. Davis. She is the professor at the University of Tulsa. She's been conducting these nightmare studies since 2001. Dr. Joanne Davis wrote a book on a treatment she developed for trauma-related nightmares, Treating Post-Trauma Nightmares, a Cognitive Behavioral Approach. She is continuing her research in the area of nightmares and sleep problems in people who have been exposed to trauma.
We look at the way that nightmares will impact you cognitively, so the way that you're thinking about your trauma and the nightmares, behaviorally, the way that you may change your sleep habits because of the nightmares, and then physiologically, so how it is impacting you on a physical level.
This all started with a client who she worked with for a couple of months with panic disorder, PTSD, and had nightmares. She was able to put together a protocol on her own that allowed her nightmares to be gone in 3 weeks. Her nightmare treatment study consists of 4 to 5 sessions and runs for 60 to 120 minutes with ERT therapy, exposure, relaxation, and rescripting therapy with people who are 18 and up.
So nightmares are going to be those dreams that are so disturbing that they actually wake you up and that you can remember the content of it. A lot of us will have other kinds of disturbing nighttime experiences like anxiety dreams that are discomforting in some way but won't wake you up.
Dr. Davis says they are focusing on the extensive experiences that actually wake you up. And sometimes veterans or just normal people wait years before getting any help.
They're often underdiagnosed. They can be quite serious, and many of them are treatable. And I think sometimes people believe that because it's something that happens at night while I'm sleeping, that there's probably not very many options, but there absolutely are options. And the psychological treatments tend to be among the ones with the most empirical evidence behind them.
She recruits through social media and PR and through clinicians and physicians when they learn about the trials. Dr. Davis says that if you are experiencing nightmares for longer than a month, you need to seek help, because if it's left untreated, then it could become a chronic issue and potentially affect you physically and mentally. Now, she is still accepting people into this trial, and if you're the ages of 18 or up, you are able to be within the nightmare trial. Live in Tulsa, covering news that matters, Paris Rain, Fox 23 News.